Hi, my name is Dr. Sunil Pai, and I am President, Medical Director, Medicine Man and Elder of Sanjevani Integrative Medicine Health and Lifestyle Center, also a branch of the AKBBA Native American Church. And today I want to talk to you about my flagship product called Bosmeric-SR. Bosmeric-SR is a superior natural anti-inflammatory dietary supplement for pain and inflammation support that has been clinically tested using patented ingredients. It contains 4 specific natural ingredients, including curcumin C3 complex, boswellic PS, ginger, and bioperine at precise potencies that are not only effective by themselves, but have a synergistic and more powerful effect when placed together in a unique delivery system. Over the past decade, research now suggests that all disease begins and is worsened by inflammation. The word inflammation comes from the root word flam or fire. Inflammation is like the fire within our bodies. Our immune system needs a certain amount of inflammation to maintain its health, just like your food needs a certain amount of heat to cook on the stove. However, if the flame is too big, your food will burn. Similarly, when there's too much inflammation in the body, disaster strikes. Let me give you a few examples. Here's a healthy knee, and when it is chronically inflamed, we call that arthritis. A normal colon with chronic inflammation, we call it colitis. Heart disease is now viewed as an inflammatory disease where the heart vessels become inflamed, and then the cholesterol deposits to help lower inflammation and thus leads to heart disease. Same goes for the brain. Over decades of inflammation, we see plaques being deposited as a result of inflammation, and hence brain disorders such as Alzheimer's and dementia set in. Now we have over 200 itis conditions. These itis conditions stem from inflammation. Most people usually treat the symptom with a specific drug, such as conjunctivitis or red eyes with eye drops, rhinitis or runny nose with nasal sprays, arthritis with oral pills, and dermatitis with steroid creams, treating the symptom over and over and not healing the root cause, which is often inflammation. Bosmeric is different. Bosmeric-SR, with its clinically tested, patented, potent, and effective doses of turmeric, boswellia, ginger, and black pepper, can reduce and even reverse your inflammation. In my practice, I prescribe Bosmeric-SR and have seen amazing results when used for the following conditions, such as arthritis and rheumatoid, PMS and menstrual irregularities and fibroids, headaches and migraines, joint and muscle pain, fibromyalgia and chronic pain, ulcerative colitis and Crohn's disease, psoriasis and acne, lung conditions such as allergies, asthma, COPD, and emphysema, heart disease, diabetes and neuropathy, obesity, liver dysfunction through toxic insults, memory and cognitive problems such as Alzheimer's disease, Parkinson's disease, and other neurodegenerative diseases, autoimmune diseases such as rheumatoid, MS, and lupus, and finally, various types of cancers such as brain, breast, colon, thyroid, prostate, and lung. No one has combined the clinically tested and patented forms of curcumin, boswellia, ginger, and black pepper in this way before. Bosmeric-SR is convenient, easy to swallow, and works in as little as 20 minutes and is then sustained release for 8 hours. Compared to non-steroidal anti-inflammatories, or NSAIDs, such as Advil, Motrin, Aleve, and Celebrex, Bosmeric-SR does not have a black box warning. The black box warning for NSAIDs state that you can have a fatal heart attack, stroke, or GI bleed at any time without any warning symptoms. Please see our What is a Black Box Warning video for more details. Bosmeric-SR is a safe and effective NSAID alternative. Compared to other anti-inflammatory supplements on the market that use generic, ineffective sources of ingredients and have very limited human studies, Bosmeric-SR uses the highest quality and potency of patent ingredients that all have been clinically tested and provides unsurpassed safety and efficacy. Bosmeric-SR is the only natural anti-inflammatory dietary supplement that has a bilayered sustained-release technology. 2 unique layers of the easy-to-swallow caplet allows for maximum delivery of its ingredients. Layer 1 contains Boswellia and ginger. Boswellia serrata is commonly known as frankincense. Boswellia or frankincense is most recognizable as one of the gifts that the Magi brought to baby Jesus. Boswellia has been used for thousands of years in India, China, and Greece for treatment of inflammatory conditions such as arthritis and asthma. More recently, it has been used in the United States and Europe for treating arthritis and pain. It has been shown to be effective on specific areas such as the brain and lungs, and to those patients with neurological conditions and asthma. Most Boswellia products are not standardized to the key parts like boswellic acids and AKBBA. However, Bosmeric PS used in Bosmeric-SR is the newest and most effective Boswellia extract available. It not only contains the important aspects of boswellic acids and AKBBA, but also contains the newest discovery of a polysaccharide called polysol, which at appropriate ratios provided in the Bosmeric-SR has a synergistic effect to improve the actions of boswellic acids and AKBBA. It ensures quick absorption, allowing for an immediate action within 20 minutes and then continued sustained release over 8 hours. The patented ingredient Boswellia PS is exclusively only found in Bosmeric-SR and no other products. Layer 1 also contains ginger. Ginger has been used for thousands of years in cooking throughout the world and in Ayurvedic medicine and other traditional medicines for its anti-inflammatory and GI calming effects. Research has identified that the compounds called gingerols are one of the most important in ginger. Bosmeric-SR contains gingerols standardized to 20%, which is the highest available potency worldwide. Layer 1 is unique in its creation and its sustained release over 8 hours. Layer 2 contains curcumin. Curcumin is derived from the spice turmeric and has been used in India for 4,000 years in cooking and Ayurvedic medicine. It is one of the most widely researched natural ingredients with over 5,000 publications to date and counting. Curcumin has been shown to exhibit antioxidant, anti-inflammatory, and anti-cancer activities. Curcumin C3 complex is the gold standard for curcumin supplementation and has been successfully used for over 20 years. In addition to its unsurpassed clinical efficacy, it also has an untouchable safety profile being used worldwide by millions of people. This patented form has more human clinical studies than any other curcumin supplement. Curcumin C3 complex was the first to standardize and patent the extraction of the 3 important curcuminoids at specific ratios. Unlike what is used in generic turmeric and curcumin extracts, only using curcumin C3 complex have these ratios. Layer 1 and 2 both contain black pepper. Black pepper is commonly used in cooking and is found on almost every kitchen table worldwide. Research has shown that black pepper not only has anti-inflammatory and antioxidant properties, it also increases the absorption of the other ingredients from 30 to 60% when taken together. Ayurvedic medicines commonly use black pepper in their formulas to increase absorption in addition to its other actions. Bioperine is the patented standard of black pepper extracts. It contains the standardized extract of black pepper to 95% piperine. With its excellent safety profile and bioavailability enhancing effects, Bioperine helps boost the anti-inflammatory properties and absorption of the unique combination of curcumin C3 complex, Boswellia PS, and ginger extracts. Other combination formulas of similar ingredients or those that include bromelain, proteolytic enzymes, or nattokinase are manufactured in capsules that degrade the potency of the curcumin and Boswellia in the capsule over time. Thus, by the time the consumer takes the product in capsule form, the potency has significantly decreased due to the degradation of the ingredients being placed and mixed all together in a capsule. This leads to lower efficacy and poorer outcomes. Bosmeric-SR is the solution to this problem, as the bilayered separation ensures potency at the time the easy-to-swallow caplet is taken. Thus, every caplet is guaranteed to have the potency of those ingredients in the amounts on the label in the bottle at the time it is taken. The bilayer technology provides a fast-acting relief within 20 minutes and then a sustained release effect over 8 hours. Traditional medicines, such as Ayurvedic medicine, have long understood the importance of synergistic blending, which is the art of combining multiple compounds to maximize their efficacy. Pharmaceutical drug companies synthesize drugs with one single agent, losing the potential benefits of synergy. The same goes to supplement companies that only provide single natural ingredient products. These single agents are often so specific that if they arrive off target in the body or are not well balanced correctly with other compounds, there's potential for side effects. Natural ingredients are thus safer, and when combined synergistically, are more potent. Such compounds have a balancing effect and can be used over long periods of time without building a tolerance or decreasing the efficacy. A perfect example of the synergistic effect is demonstrated with Bosmeric-SR by combining curcumin C3 complex, Boswellia PS, ginger at 20% gingerols, and bioprene. Bosmeric-SR is manufactured to the highest good manufacturing practices and certifications available. Unlike most products that use generic ingredients bought off the world marketplace and third-party vendors, the ingredients in Bosmeric-SR are carefully controlled from farm to manufacturing, from patent processing and potencies to the human clinical trials. With this vertical integration process, no other product is as highly committed to quality. In addition, Bosmeric is 100% natural, non-GMO, non-irradiated, gluten-free, soy-free, and kosher.